Hello, everybody. Welcome to today's informational webinar with Q&A for our upcoming strategic collaboration for better community health, well-being, and equity workshop. We are so excited to be hosting you today from the Population Health Innovation Lab. Today's event is going to be recorded, and a posting of this will be available on the Phil YouTube page. We will also be sharing this on the event page if you need to reference it back later. Next slide. Next slide. And to start us off today, we would like to talk a little bit about a land acknowledgement. We want to pause and acknowledge that we live and operate on the unceded lands of Indigenous peoples throughout the United States. At Phil, we are a remote team, and so we recognize that we are on many unceded lands across the US, and that the land acknowledgement is really just an important way for us to honor the Indigenous peoples that have been stewarding the US land since time immemorial. But really, this is just a starting point. We invite you to all learn about the tribal nations and Native communities of which you are a part of and are sitting on and in relationship with by your location. I am currently joining from Hawaii, the traditional land of the Namoku'eha people, and we would love for you to check out a little bit more about your area and moving beyond land acknowledgement by visiting www.nativegov.org. Next slide. For our agenda today, we're going to start off by sharing a little bit more about the Population Health Innovation Lab, or PHIL as we like to call it. We'll share a little bit about the PHIL Collective, and then we'll jump into more details and logistics about the workshop, providing an overview and really jumping into what you can expect on day 1 and day 2, and just the value add that this really has to your organization, no matter what kind of organization you are in joining this work. We'd also like to share a little bit more about the lead trainers and then open up for some discussion and questions. So to start us off, the Population Health Innovation is really providing innovative training, research, and technical assistance that's designed to catalyze and accelerate these community efforts that many of you are likely engaged in, aimed at enhancing equity, well-being, and systems change by working across boundaries, across sectors, and really centering collaboration. So we do this a lot in lots of different ways, and offering this workshop is just one of them. Next slide. Relevant to that, I'm really excited to share a little bit today about the PHIL Collective. PHIL has very long been thinking about the launch of this exciting opportunity to really engage those that are working in this multi-collaborative space, multi-sector space. We'd like to be able to provide things that we are hearing are needed, from peer connection to specific explicit training to workshop experiences, to really longer term experiences like learning labs or things like access to TA. We've launched this PHIL Collective this year. We currently have a number of types of things that we're offering, from web discussions to workshops, which you are hearing about today, as well as learning lab experiences. And we're excited to be able to grow this more in the future. So this is part of the PHIL Collective. Next slide. With that, I'm going to turn it over to my colleague, Stephanie Bultema, to share a little bit more about the workshop.
Thank you, Christina. So the Strategic Collaboration for Better Community Health, Well-being, and Equity Workshop offers 2 days of hands-on teaching and learning to help you leverage collaboration as a strategic approach to improving community health systems, advancing equity, and sustaining collaborative outcomes. We currently have 3 workshops planned in early 2025 in both virtual and in-person formats. The Strategic Collaboration for Better Community Health, Well-being, and Equity Workshop welcomes participants from multiple sectors and will be available online in January 2025 and in person in Denver, Colorado in February 2025. We're also offering a version of this workshop as part of our Foundation Forward collection of trainings, which are tailor-made for health departments seeking to elevate their essential public health capabilities. The workshop that's tailor-made for public health departments is called Collaborating Across Boundaries to Improve Population Health. And while it includes much of the same content as this main workshop, it's tailored for local health departments by connecting content to public health accreditation, community health assessments, and community health improvement planning, and the foundational public health services. This workshop will be held online in January 2025. Now let's review what we'll cover throughout the workshop. The first day emphasizes applying collaborative theories and frameworks to real-world collaboratives. And we'll really pull in frameworks, theories, and ideas from all sorts of disciplines, not just public health. We'll kick the day off with a get-to-know-you breakfast for in-person attendees, and then we'll spend some time welcoming everyone in, reviewing the workshop plan, and getting to know each other. We'll spend most of the first day exploring key concepts related to collaboration for improved population health, including what we've learned from Phil's Aligning Systems for Health research, why strategic collaboration is needed to improve population health, and which theories and frameworks from those various disciplines, including economics, political science, management, and public health, how these can guide your collaborative efforts. We'll then take a break for lunch with a meal provided for in-person attendees. In the afternoon, we'll explore how collaboration can create positive changes in your community health system, and then we'll apply what you've learned to your own work by providing space to apply tools and resources shared throughout the day. We'll reflect on the day's content and how your knowledge, understanding, or ability in strategic collaboration changed throughout the day. And we'll close out by reviewing key points for each learning objective and reviewing the plan for day 2. By the end of the first day, you'll be able to describe 3 main findings about how collaboration leads to outcomes from Phil's Aligning Systems for Health research, explain at least 2 collaborative theories or frameworks, and provide an example for how evidence-based theories and frameworks can guide strategic collaboration. We're also expecting that you'll be able to name at least 2 new people you met who are not us on the Phil team. So now let's take a look at day 2, which focuses on how collaborative work can advance health equity and be sustained over time. We'll start our second day together by reviewing and reflecting on what we learned in day 1. Then we'll spend the rest of the morning exploring how collaborative strategies can advance equity and population health outcomes, and how collaborative productivity can be sustained over time. In the afternoon, we'll have dedicated time for practical application, including developing a collaborative action plan that applies directly to your work back home. We'll reflect on the day's content and areas of growth throughout the workshop, and we'll close out by sharing collaborative action plans so you can learn what other people are doing, reviewing key points for each learning objective, and celebrating lessons learned and areas of growth. By the end of the second day, you'll be able to provide 2 examples of actions you can take to advance equitable outcomes through your collaborative efforts, and 2 examples of actions you can take to sustain collaborative productivity. By attending this workshop, you'll gain knowledge about research, theories, and frameworks that can guide your collaborative efforts, practical examples of successful cross-boundary collaboration, actionable resources to guide your collaborative work, dedicated time to apply lessons learned to your own work, connections with peers across the nation, and a certificate of completion. So now just a quick overview of who we are, who you'd be learning from in this workshop. My name is Stephanie Boltema. I work as Director of Monitoring, Evaluation, Research, and Learning Innovations with the Population Health Innovation Lab. I've been with Phil since 2020, around the same time as Christina. And before starting at Phil, I had a long history working in my community, largely in public health, but also in nonprofit organizations and even sometimes for-profit companies. But all of my roles were centered around serving my community in some way to advance well-being, whether that be from the economic development perspective, the education perspective, or the public health perspective, which is where I've spent most of my career. And in my early career working in public health in the Spokane Regional Health District, my role was really to serve as kind of a data liaison, an ambassador for public health data and effective use of data to guide decision making in public health. And I was out in the community all the time, supporting education-focused collective impact initiatives and our local Chamber of Commerce, which was supporting a workforce development initiative using a collective impact approach. And day in and day out, I saw how challenging this work was. I mean, I was a part of these teams. I was in the thick of it, trying to figure out how do we engage people effectively? How do we create a shared vision? How do we figure out how to create this collective impact that we all see as possible? And in that role, I was finding I was kind of a data support, but I was finding that I couldn't find good methods or evidence for how this could be done well. And as we were seeking to figure out how do we do this really complex collaboration, how do we generate these collective outcomes together, I was finding that there was not a whole lot of evidence to inform our decision making. And so that's what sent me back to school in 2017 to really dig into figuring out, okay, if public health doesn't have the answers for us, where can we find these answers? And I was delighted, surprised, and really just overjoyed to find that other disciplines outside of public health have been studying this stuff for decades. I mean, really, the management and economic and political science literature is just a gold mine for us in public health, even the business management literature when it comes to how to do this large scale collaboration well. And so, I've just found my happy place in Phil being able, because that's what we focus on is this kind of multi-sector, large scale cross-boundary collaboration. And so alongside the Phil team for the last 4 going on 5 years, have really been able to apply these lessons learned and continue to build this out alongside amazing colleagues like Christina, who I will hand it over to now to share a little bit of your background and what brings you to this workshop as an amazing trainer that people might want to learn from.
Thank you so much, Stephanie. I am hoping that others also are hearing just the passion behind the passion that you bring to this space. I have absolutely loved just working with you in developing these things, working on the research and the background. I think it's one of the things, the highlights that brought me to in my early time at Phil, to really just feel like this work was of value, what we were doing, what we were trying to achieve. For context on that, as Stephanie mentioned, we both came to the Population Health Innovation Lab around the same time. Prior to joining, I had been working on the ground for a number of years in a rural border community that was organically coming together really across so many different sectors, from healthcare, business, education, public health, social services, behavioral services, trying to understand how we could improve community outcomes with community-based solutions. We were trying to figure out, like, how do we really empower community to be part of this process? How do we really make sure to meet them where they are, to do skill building if they feel like they need that, to really be shifting how we were doing work so that it wasn't just a way of coming together for some short-term kind of thing that was happening, but instead like really changing the system and changing how we viewed our ability to do impact in the community. So I came from 4 years of doing that, had a really amazing time, but also saw a lot of the challenges that you experience doing that work. It's a really long-term game. You are often trying to change things that take decades to come to fruition. And at the same time, you're having to keep people at the table, trying to make sure that they understand why they're there and why they continue to stay there, identifying and really clearly communicating what those short-term quick wins are, and really helping people to understand that they all have a valued perspective at the table, no matter where they're coming from. So I love that I came with that background and kind of understanding, and was brought into Phil to really do the research side of it, to say like, wow, there's so many other communities out here doing this work. How can we really understand what works for who and why and when, and scale and share those things? And when I say scale and share, I also just want to emphasize that, yes, there are things that work in some communities that are not going to work in others, but we have heard over and over and over again how important and valuable it is for peers to be in connection. And I think that's one of the things that we're so excited about for this workshop, is that we are going to be bringing people together for that opportunity to connect and learn and grow. You might hear something valuable from us, but also just this great opportunity to be in space with others. I think is of major value when you're coming from that perspective of like being so honed in and really focused on the ground with what you're trying to achieve. But anyway, that's a little bit about that. I have also worked in research prior to that. I did some research background with the National Institutes for Health. I've worked with the federal government as well, worked in a county health department. I have lived in a lot of different places and communities and just have a real passion for digging in and getting to know your neighbors and trying to understand how to be in space and improving wellness at that level. So a little bit about me. Thank you so much for sharing. I'm hoping that you are just as excited and jazzed as we are about this workshop. With that, we're going to do just one more slide to share a little bit more about why Phil, why now? So as we mentioned up at the top of this training, we are so excited to have just recently launched the Phil Collective, which is this brand new kind of hub that we're hoping can be a place for those that are working across sectors to really come together, to be in learning, to be in connection, to really dig into like the challenges and understand them from a different perspective. A lot of the things that we have in the planning pipeline for the Phil Collective are based on years of experience working with lots of different collaboratives across the US. And what we're really excited about is that we are trying to take this approach of saying, we keep hearing these needs come up over and over and again. Like, why can't we just fill that need and fill that gap? So a lot of what you'll be hearing come down from the Phil Collective is us really trying to make sure that we are talking and speaking directly to those things. So this is part of that. In addition to that, I think one of the things that really enriches this workshop experience is that it's building, as I mentioned, on this aligning for systems for health research with accountable communities for health across the state of California and Washington. There were over 25 communities that have been engaged in this work for a very long time, studied and worked with to really understand how to inform the evidence base that is going to be used for this workshop. I'm really excited about that, and just to be able to pull out those really specific examples and use cases that will make your work and make that relatable to you in a different way that we hear is often valued. In addition to that, we're really excited to be able to inform this training with our years of work that was built into a powering change curriculum. Phil has a curriculum that is really intended to help you build healthy equity communities. It's 300 plus pages, chock full of resources and opportunities for you to see how you can do this work more effectively. And so we will be integrating Powering Change curriculum tools and resources. You will also receive a copy of the Powering Change curriculum as a result of participation in this workshop to really help enable you to just carry on your own journey in this, your learning journey, in terms of if you heard that you were really interested in equity and understanding what else you could do around that. Like, there's a whole module in there related to that. If you're really trying to understand how to build out a portfolio of things that you can be doing to really talk about addressing the systems level issues at different levels, there's a whole module about that. Governance of these types of things. Like, there's, this is really informed by work with people who have been engaged in multi-sector cross-boundary work for many years, who really said that these are the nuggets that people need to understand to do this well. So we're excited to be able to share that with you as well. And with that, I think we've provided kind of our overview here. I would love for us to be able to jump into some questions. If we hadn't shared already, apologies. Please feel free to use the Q&A feature to put in any questions that you have about the content. I think I've seen a few coming through during this event. I know we also had some questions that we populated into there that we got from registrants ahead of the event. So I'm going to turn it over to Katie to be able to kind of facilitate some question sharing with us here.
Oh, okay, thank you so much, Christina and Stephanie, for that overview. We're going to dive into some questions that we had from registrants for this webinar. And if anyone here has any more questions, please feel free to put them in that Q&A feature right now, and we will do our best to answer them. So I'm going to go ahead and get started on the first question. What will enable work to continue and grow beyond the workshop?
Such a good question, Katie. I really appreciate that. I think that's a multi-tiered answer. I will say, as I just mentioned, we are going to be providing folks with a copy of Phil's Powering Change curriculum, which again is that 300+ page resource, which really dives into a lot of ways to support many different concepts that are critical to helping form a multi-sector collaborative that's really effective, sustainable, bringing people together in meaningful ways. So that's one thing. I think though, for people who are feeling like they just want to be able to have some self-exploration, some really understanding of what the canvas of tools are out there in different areas, that will definitely be an additive support for folks. Related to that, I think that the real value, as we've kind of mentioned, often that we've heard from folks is this desire to be in connection with others who are doing this work, who are experiencing the same thing. So one of the things that we're doing, again, Phil Collective is new, is we're trying to explore like what really makes the most sense for you all. We are considering things like maybe we create a group on LinkedIn where we can put folks who have been participants in these workshops together in there. So that way you can really be in connection with your colleagues and say like, hey, this thing has come up. I'd love an answer to that. If you all are in the workshop and you're like, that's really not where it's at. Like, I don't want that. We'd love that feedback because having worked on the ground, I know how crazy and busy it was. I felt like I was, sometimes in a circus juggling 10,000 balls, trying not to drop one of those balls. And so maybe a LinkedIn group wouldn't work for you. So very open to that. I think, we're exploring those opportunities. Stephanie, anything else to add? All right.
Okay, the only thing that I'll add is also, I didn't speak to this, but even both in the in-person workshop and the virtual workshop, we're making sure to build in time for you to connect and get to know other people who are doing similar work. And so at the end of every day, there will be a 30-minute scheduled, just informal networking, question and discussion time. You're welcome to stay or not, to ask questions, connect with others. And so we really will be building in opportunities for you to connect, engage, and get to know people who are grappling with similar challenges that you are. And my hope is that those relationships that you forge during the workshop will also help you to continue to grow the work beyond the workshop.
Great. Thank you so much, Christina and Stephanie. I am just rolling through these questions. There are some from our registrants, and then there's a live question. If I am unable to attend the workshop on the selected dates, is there an option to transfer my registration to another participant or another event?
Yeah, so thank you for that question. I think the big thing here is you want the same person to be at both days of the training. And so it's not one thing where you could have one person attend one day of the training and a separate person attend the second day. The real value is the adding on of lessons learned across the 2 days. So I think, if you sign up and for some reason later down the line you can't attend, but somebody else from your organization is able to go in place of you, we're very okay with that. We would just need to be able to know that. You could let us know on info@pophealthinnovationlab.org, and we can get that sorted out. But again, it really should be the same person across the 2 days.
Great. Thank you, Christina. All right. And then going off of some more questions we have in here. Next question, will participants have the chance to work on real-life collaborative projects during the workshop?
Yes, the idea is that you'll have the chance to work on your own real-life collaborative project. And so our hope is that, while there's value to this workshop for anyone who's interested in cross-boundary collaboration or cross-sector collaboration, our our hope is that this will be super valuable and impactful for people who are doing the work. And so if you bring in your own real world collaborative work, that is where you'll get the most value. If you say, I'm working with this collaborative, we're at this stage, we're trying to figure this out, and you bring those challenges or those questions to the workshop, that is where we're going to ask you to draw on your own experiences, your own context that you're bringing to the workshop, so that you can not only advance your own work, but learn from the work of others. Christina, anything you want to add to that?
No, I think that was great.
Great. Thank you so much, Stephanie. All right, next question, and I'm going to move back now to the registrant questions here. Next question is, would you recommend a practical playbook or tools that I can use to contribute with our partners in collaboration progress?
I'll kick this off, but definitely curious to hear what you think too, Christina. We do not plan on recommending one practical playbook. However, there are so many wonderful resources out there, a lot of practical playbooks that we could share and we'll make sure that you're aware of. We'll highlight a few that are really applicable to our course content throughout the day. And the main playbook that we'll be sharing that we think will be most beneficial for y'all is the Powering Change curriculum. Not exactly a practical playbook, but it goes through all of the different steps, stages, main areas that you need to focus on when doing this kind of work. And within that curriculum, there are different playbooks, guides, resources, tools. So we'll be highlighting those throughout the 2-day workshop. And ultimately helping to match you with the right resource for what you're looking for, but generally recognize that there's no one playbook that is the best for everyone. Christina, what do you got?
Yeah, I think that's great. And I think just to add to that, I want to highlight that the Powering Change curriculum was done in collaboration with so many other experts. We at Phil, again, do not consider ourselves the experts in all the things. The power of that curriculum is that it really harnesses the lessons learned, the expertise, and the understanding of so many others that are in this space, helping to support multi-sector collaboratives. So that is chock full of resources, not just that we have developed at Phil, but that others have developed and said, hey, this is really where it's at that can really help others in this specific area.
Absolutely. What a treasure trove of information. Thank you both. As we're winding down into our last minute here, I would like to ask one more question from a registrant. Last question, does this tie into community schools and how can we build connection?
I love this question. And yes, absolutely. So I mean, this workshop, while it's focused on multi-sector cross-boundary collaboration for improved population health, equity, and well-being, community schools are doing so many of those same things, leveraging the shared assets of communities to ensure that kids have all of the resources, tools, care, love, services that they need to be healthy and thrive in their educational setting. And so I will warn everyone that like it is more of a health perspective that we're bringing to collaboration, but also recall that like I came to this work because of a health-focused multi-sector collaborative, a Strive Together Cradle to Career network. And everything that I learned there is so exactly applicable here. And so if you are in a position where you are seeking to create community-wide connections and impact, build relationships, and bring together different individuals, communities, schools, services to create greater impact than you can in a single school or a single clinic, then absolutely there's value for you in this workshop. Christina, anything to add from your perspective?
No, that was great, Stephanie.
Amazing. Well, that concludes our time with the question and answer, and I will hand it over to you to close us out.
Yes, thank you all so very much for joining us today for the webinar information session. As we mentioned at the top of this event, this has been recorded. We will be posting and sharing this out after the session. We invite you to continue exploring more about the Population Health Innovation Lab and the Phil Collective here at pophealthinnovationlab.org. We're on LinkedIn and Eventbrite, so stay tuned for all the great things to come and be in touch if you have any additional questions. Thanks, everyone.
Thank you all.